Good evening. In this hour in which India is facing so much trauma as a result of COVID, there is a great deal of foreign assistance which is coming our way. Aid from the European Union is one of the key constituents of that aid, and there is a lot of aid coming, whether it's oxygen generators, medicines, oxygen cylinders, antiviral medication, and a whole lot more, even PPE kits. Where exactly is this aid going, and is it serving the purpose that it is meant for? Joining us now, a very special guest, Ugo Astuto, the Ambassador of the European Union to India. Thank you very much, Ambassador, for being with us.
Thank you.
There's fantastic aid coming to India, for example, oxygen generators, which we need so desperately in our country. Are you satisfied that it's getting to where it's needed most?
Well, yes, we have activated the European Civil Protection Mechanism, which is meant to coordinate help from all the 27 member states. And in the past few days, as you know, we have got flights landing in Delhi from Romania, from Ireland, Belgium, Germany, France, and Italy, and we're expecting a few more flights. And the aid, as you said, I mean, the support is focused on oxygen-related material, other health equipment, and antiviral drugs. Now, all deliveries are handed over to the Indian Society of the Red Cross, and the further dispatch is care of the Indian authorities with the lead from the Ministry of Health. And I'm sure you've read already reports about hospitals having received the oxygen plants brought in from France or Italy. At least some of them, one or two, may be operational.
Yes.
Already.
One of them is operational at Max Hospital here in Delhi. The other one in a hospital in East Delhi, is what I understand. I'm just trying to understand, what is the system of checks that the European Union has after it is handed over to the Red Cross? We are told it goes to a company called HLL. Is that, on the basis of that, at some stage, do you get some sort of notification saying where it's gone?
Well, look, this support has been, this package of support has been devised based on the conversation with the government of India in the European capitals, in the individual European capitals at the central level in Brussels. So based on these discussions, we have brought together member states which have been supplying this material. So the focus now is on oxygen. When it comes to the delivery, so our contact point is the Indian Red Cross, and then the health ministry takes over. The individual member states do have regular discussions with the Indian government when it comes to the overall delivery of the aid. So obviously, with such a massive operation, the logistic is very complex.
Ambassador, I understand that, but I think the reason we ask this is because while a lot of the aid, for example, oxygen concentrators and oxygen generating devices have gone to very good and very big government hospitals like the All India Institute of Medical Sciences, not just here in Delhi, but also in other parts of the country, there are literally smaller hospitals gasping for breath, small nursing homes, and they haven't got any aid, and it's been several days. And as you know, sir, it's a daily crisis. So the question is, could there not be a better way in which aid gets to people who need it desperately on an hourly basis?
Well, we all know the situation is serious, and that's why we are trying to help as much as we can, and that's why we are having a pretty intense conversation with the Indian authorities.
And are you satisfied with the response that you're getting from the Indian authorities?
Well, look, so far, I mean, we have got a very, very cooperative response from the Indian authorities, and let's remember it's a very complex operation and logistically challenging.
Could you, Ambassador, tell us a little bit more about some of the aid that's going to come in from the EU? How much longer do you expect the aid to keep coming?
Well, look, for this week, I expect several other flights from the Netherlands, two from the Netherlands, one from Austria and the Czech Republic, another for Germany. So there are quite a few for this weekend over the weekend.
Ambassador, I'm just trying to understand the procedure that, you know, the aid comes in, you hand it over to the Red Cross, and then the Red Cross interacts with the government of India. You obviously do that as well, and then it gets distributed. Is this part of a new system, or is it the way it's always been?
Well, this operation is new. I don't think there is a way it has always been. It's something new. It's I think we have already a press release from the government of India today, where it referred to the establishment of a task force and nodal officers.
Right. And could you point out, through any examples on how aid from the EU is really helping Indians already on the ground? You would have heard back from certain hospitals, or tell us, sir.
Well, you did refer to the oxygen generators. I mean, I think these machines can produce oxygen and they save lives.
All right, Ambassador, thank you so much for speaking to us, giving us a sense of where you hope that aid goes, and we certainly hope it gets to people as fast as possible. Thank you very much, Ambassador, indeed.
Thank you for inviting me.